Now, last night I showed you another example of the disgraceful COVID-19 fear-mongering that's happening at your expense at the ABC, courtesy of Norman Swan. So many times over the past 2 years, we've shown you examples of Swan exaggerating risks, spreading fear and getting his predictions all wrong. And he continues to hyperventilate about the pandemic. But few of his examples have been as badly wrong or as personally traumatic as what he did yesterday. Swan told ABC audiences, without evidence and without getting his facts right, that two prominent Victorians who died early this year, Labor Senator Kimberley Kitching and cricket legend Shane Warne, he said they'd died from the delayed effects of the COVID-19 virus.
My view is that it's too much of a coincidence that Shane Warne and the Labor Senator in Victoria died not long after a COVID infection. And people are reporting sudden death after a COVID infection. It's not benign.
Look, this is terrible. Kitching's family have revealed she never even had COVID, and Swan has been forced to apologise for getting this wrong. He's also come in for criticism from the former Deputy National Health Officer.
I think Norman would be the first to agree that it wasn't his best moment in the pandemic, and I read the news wires this morning. I understand he's apologised for it, and I mean, I think the thing is you can't go wrong if you just avoid making assumptions about individuals and speculating about causes of death, particularly when they were both so tragic. And really, that sort of speculation, I think we all recognise has no place in the COVID discourse.
Now, aside from the personal presumption, the guesswork and how unfair that is to the Warne and Kitching families, the key point here is how Swan's claims just spread unwarranted fear in the community. To defend his actions, the ABC health commentator has cited a report that looked at data from 2020, the early part of the pandemic, before there were vaccines, different variants, more knowledge and new treatments.
Another sin, really, if you will, is that it's creating this concern with a study that was really conducted in a different era of the pandemic. That's also a problem.
Now, this problem of pandemic paranoia, this fueling of public hysteria, is not a story of the past. It's still playing out. For instance, Woolworths have only just today finally announced the removal of a vaccine mandate for their staff. People have lost their jobs over these unnecessary and illiberal mandates. Now they're gone, for Woolies at least, but they remain in place for many other large employers. People are being kept from work, even though all the medical evidence says those without vaccines pose a risk only to themselves. The vaccines only help individuals cope better with the disease. They do not stop infection and transmission. We've suspected this, of course, from the data for at least a year. We've been talking about it on this program for over a year, and it's been abundantly clear on all the available data for all of this year. Yet people are still being discriminated against. For Woolies, it's better late than never. But for many other companies, it's high time to catch up. We've got labour shortages in this country, so stop unfairly stopping people from working.